Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. Let's get into it. Today, we have Lindsey Maloney, an NP from Connecticut. Her practice is called Mobile Care Partners. She started her practice in her car, and now, only 5 years later, she has an office and sees over 3,000 people. And she did it her way. You are not ready for today's energy. Let's dive in. So, Lindsey Maloney, I'm so excited to have you here.
I'm so excited to be here. Thank you very much.
Of course. Before I hit record, I was telling Lindsay how everyone talks about how amazing Lindsay is. So now the audience gets to find out how amazing Lindsay is.
Yeah, but I shared the truth. I shared the truth about the large payments that I need to make to get all of that praise, and that I'm really not the interesting one. They all really love my mom, who is also my office manager. So,
all right, next time we'll have mom on the show.
Yes. Oh, that would be an interesting one.
That interesting show. We have to keep it rated G, so I don't know if that's going to work.
All right. Well, good luck.
Let's start with what led you to be a nurse practitioner?
So when I was still in nursing school, my advisor had suggested that I continue on to be a nurse practitioner. But at that time, I thought, this woman is absolutely nuts. Like, I can't understand. What is she talking about? There's so much to do right now. She's looking way too far in the future.
Yeah.
My only focus was just finishing up school, passing the boards. So fast forward a few years, I'm 9 months out of school. I'm the most seasoned nurse on a med-surg and stroke unit. I'm designated as the charge nurse with no idea what that entails. And I'm training a new hire with a 6-patient assignment. So while I'm hurriedly pushing meds through my patient's G-tube, the stopcock pops open, exploding all of the crushed meds, probably more, full force, all over me.
Oh God, there's nothing like a G-tube explosion. Anyone who knows it's disgusting.
The worst. And now, mind you, this is
right
like
in your
8 o'clock.
face also, right? It's right in your face. Yeah.
Right in your face.
Yeah.
Right in the 8 o'clock in the morning. First thing.
Amazing. Gorgeous.
So
the visual, chef's kiss.
So that really was it. I was already getting frustrated. That was pretty much the straw that broke the camel's back.
Oh, so we have the G-tube to thank you for.
We do, for sure. So, but at first I made a step first. I said, all right, let's see. I'm going to go to the ICU. So I get there, and all of the nurses who are older than I am are crippled with musculoskeletal issues. Crippled. They're all having surgery. They need help, all this stuff.
So true. So true.
You know, right? So
everyone's got a back injury.
Exactly. So I love taking care of patients, but I really was not willing to volunteer the rest of my life filled with chronic pain and back-breaking work. Still wasn't sure.
For anyone who might be listening to this who doesn't know what we're talking about, because I imagine most of our audience is NPs, I think what people don't appreciate is that you get different patients of all shapes and sizes that are now bedbound, and you have to take care of them. And you have to suddenly, I don't lift a couch in my house. I have people who move furniture. You're suddenly moving sometimes the weight of a piece of furniture up and down the bed several times a day to be able to take care of your patients. And we were never designed for that. They don't put you through physical training. And people get really injured. And so I don't think people appreciate the physicality, the physical work of working on the floor. So thanks for bringing that to light. Yeah. Okay. So here you are. You're like, I'm not breaking my back. Not another G-tube will ever explode in my face.
Yeah.
Okay.
And I'm like, all right, what am I going to do? I decided I was going to change careers, and I
what?
I was going to be a personal trainer. I even got a loan, school loan, everything.
Yes.
And then I'm like, what am I doing? This is so crazy. And that's when my advisor's words resurfaced into my brain, and I was able to reimagine my future in nursing in a totally different way. And that was really the big thing that pushed me to go to NP school.
That's such a great story. Everybody has such different reasons, but it's the timing is everything, right? Because when you tell a student in school, stay for more school, they're like, are you crazy? I just want to graduate. Don't talk to me about any more school, especially in nursing school. It's so wickedly hard. And you're like, I'm not
Yep,
doing this ever again. Um, but then, but the timing, you need G-tube explosions for everyone. I'm loving
that's
this.
it.
This is
Changes your life.
it changed your life. Oh my God, that's crazy. So how long were you an NP before you opened up your own spot?
4 years.
4 years. And then what was the light bulb moment? What was the G-tube moment for you to say, I'm out, I'm doing my own thing?
I actually really loved my job when I first got out of nurse practitioner school. I went to a community health center and I loved it. I loved my patients. I had a great team. I faced challenging experiences every single day, and I really made a difference in the community. And all of that changed when our CMO got fired and
Here's
was
the
ripped.
G-tube moment. Okay.
Yep,
And
here's the G tube moment.
there's
Um,
no more light bulb moments for me. From now on, it's G-tube moments. Okay.
I like it. It's way more fun. It's way
Way
more
more fun.
nursing.
People are like, what? Okay.
And so when our CMO was replaced, the goals of the clinic shifted from patients, community, and collaborative care to productivity, checklist items, and diagnosis codes. The system that I was so proud to be a part of was starting to really feel like a stranger. And again, I found myself, where's my role in this? Where's my
Hmm.
role in nursing? I was fearing the future of primary care and trying to figure out how I'm supposed to balance my own personal values that sometimes were conflicting with my job description.
Yeah.
But that was really when I figured out that I wasn't 100% sure at the time what the solution was going to be, but I knew that I was committed to finding one that was going to value patient centered care and still promote financial sustainability.
I'm hoping the CMO maybe listens and realizes that we have now equated him with a G-tube explosion. So
It's a she.
she,
I was
she.
so excited to have a
That's really
woman.
disheartening. I'm
I
sorry.
know. I was so bummed. However, we didn't really get along very well. And she ended up signing me up for leadership coaching, which again changed my whole life in a really positive way.
Oh, you did
So,
the coaching.
oh yeah, and I continued it after I left. And then I restarted it again a couple of years ago just
Love it.
because it had been a couple of years and I was getting more staff and I was like, all right, I should probably just kind of freshen up a little bit.
I love that. What was the leadership coaching you did? Tell us.
Um, so I met with a woman who ended up living like 15 minutes from me. It was so funny. We've met up for dinner and lunch and everything. She was I think she was a CEO of a couple of different companies. And so essentially she was hired from my clinic to help management
Mm.
on their leadership styles. I'm pretty sure mine was a form of punishment, but it ended up being all right. It worked out fine. But we would just talk
Lemons,
about,
lemonade, sis.
yeah, exactly. We would just talk about difficult situations. I think this is probably a problem for everybody is having it's difficult to be in difficult situations, primarily with communication and things like that. I tended to come off pretty strong
What
and
you? I can't imagine. You're so like mild and meek. I don't know. It must have been a different time in your life.
very different time, very different time. But now I can see those different things, and it's helped me with patient care too. And it's helped me to shift because I'm so comfortable in the patient care role. So when I'm talking to a patient about something, even a difficult conversation, I'm okay with it because I'm used to that. So she
Yes.
helped me to realize how similar that is with other people as well, and that there's really no difference except for the perceived power, right,
You
during the
know,
visit.
it's interesting that you bring this, and obviously I'm going off script because there's 400 more questions I'm supposed to ask you. But the podcast goes where it goes. It's interesting that you say this because what you're saying is you already have a skill set in one area, which is in patient care, and you can talk about cancer and dying and changing your medications and all these things. But then somehow that didn't translate for you somewhere else. And so understanding that you have the skill set and just in a different arena is really important. I recently coached one of our um, starter entrepreneurs on something similar. And so I want to share this because it's such an important point. She was starting to get patients and she was like, and I'm talking like maybe 20, 30. We're not talking like hundreds of thousands. And she was starting to feel the overwhelm. And she's like, well, how do I balance this? And how do I do this? And I was like, and she has 2 kids. I was like, remember when you had your first kid? And you were like, what the heck am I gonna do? How would I do this? And then you get to second kid and like you just kind of figure it out. She's like, yeah. And I'm like, and now you're like driving to 16 places in between eating your sandwich, driving them here and making muffins and then picking them up from school, like, and working. Like you're going to, you already have the skill set to adapt and it's going to be fine. And I was like, you're already doing this. And so anyone listening to this, if there's an area that you are not performing, take a look where you're actually doing the same thing somewhere else. And somehow we've told ourselves our story that we can't do it. So it's really good. I wanted to surface that. Thanks for bringing that up. That was so good.
Yeah, absolutely. But I mean, it's come up the entire process of the whole time that I've had the business, pretty much all of the barriers that I have
Or
come
in your
across.
head.
Yeah, they're really in
Mhm.
my head and
In your head.
I can't navigate them because I'm getting in the way.
Sis, oh my God, yes. Okay, we're gonna get there. I can't wait to get there. So you decide to open up your own spot.
Yep.
Um, so you're crazy. And because
Yeah.
all of us who open up our own spot are slightly touched. What terrified you the most?
Oh, my biggest fear was when to quit my full-time job.
Yes.
And that was a little bit more compounded because when you're at a community health center, you're eligible for federally funded loan forgiveness. And I was enrolled in the program and had just accepted another 2-year commitment when I decided to start my business. So I'm not sure if you're familiar, but the penalties for breaking that commitment are astronomical. Like interest rates, literally, it doesn't even tell you the rate. It just says at the highest rate allowed in the United States. Uh,
Way to punish people. Wow.
Agreed.
Amazing.
So of course, I'm freaking out. I'm trying. I just want to get in contact with anybody to try to cancel my acceptance, but it's the government. So that took a long time. The business was taking off faster than I expected, and every time that I have my biggest growing pain every single time is I'm going to drop the ball on patient care.
Right.
Something's going to happen and I'm going to forget something and something's going to drop with one of the patients, I still had not heard back from the government and decided I was just going to take a chance and put my notice in anyways. And thankfully, they did eventually. Nope, they accepted it. I did not have to give up my firstborn child, my life savings, nothing. So
you were all in, you were like, I don't know what's going to happen, but I'm doing this.
Yeah, I've done a lot of relying on the universe.
Yes.
That now that I'm at the 5-year mark, I'm like, all right, I need to do a little bit more than just rely on the universe here. Am I just getting lucky? But really, it's a lot of timing.
Yeah, a lot of timing. There is a lot of faith involved. There's a lot of faith. I'm not saying faith in higher power, although that certainly helps. But there's a lot of faith involved in opening up your own business and then staying on it because there's some days where nothing makes sense. There's no money in the bank account. Everyone's called out. There's, and like every scenario possible.
Mm-hmm.
You are running a fever and you have to see patients, like everything. And you're just like, what am I actually doing here?
Yeah.
And then you're like, well, I just got to keep going. So there's a lot of faith involved.
There is. And just like you were talking about with this other person that you were coaching, like you figure it out. We always do.
Figure it out. Yeah. Nurses tend to figure stuff out all the time. I mean, we're always makeshifting things. But this idea of just like, of jumping, I think any business owner knows that there is more faith than strategy.
Yes, more faith than strategy. Absolutely. It's so hard to project. How are you supposed to project? You start your business and you read these books and it's like, oh, and put together your projection for the next 5 years.
Please.
What? Where do I start? What are you talking about?
What?
Yeah.
And I'm so glad you said that because some of you who are listening might be thinking, oh, I need to get like a business proposal and then a plan. No, you don't. No, you don't. Write it on a napkin, talk to your life partner, and just do what you got to do.
That's it. You're going to put this whole business plan together and then it's going to fall apart and you're going to have to start from scratch. It's so true. Napkins, whatever you can find, diapers, it doesn't matter. You just write
middle of the night scribbles.
That's it.
Exactly right. Oh my goodness. So are you in your original location? Like the location you first got is your current location?
So my first location, well, I started off just on the road. So
I started like home care.
Yep.
Great start. Great start.
That was great because there was so little overhead.
No overhead. Yeah.
It was really like nothing. My supplies. In fact, my husband thought it was hilarious at the time because the first supply to arrive was like a giant bucket of lube, So he's like, "Oh, good, you're ready to go."
That's my wife. Not sure where she went all day, but some of it is missing currently.
Right?
That is great. That is such a great story.
I was like, Oh, this is what comes first. Okay, wonderful. But it kept our overhead so low. But then I did end up, that was in 2020 and 2022. I did secure an office space and we're still in there.
Yeah. And I love that because a lot of times people, they're imagining their ideal space. But I mean, most of us don't buy our ideal home when we first start out. You
No.
start a house, then you move up and or not, but I'm just saying generally we don't land the house. And it's the same with practices. Like it's okay to move. It's okay to start with house calls. It's okay to start with one room. It's okay to start in somebody else's office. Like just
Yep.
get going. You're not married to it. You could always, even if you're married, you can get divorced. But I'm just saying, it's not like it's not a federal loan, which apparently you can get out of also. Um, it's definitely something movable. So thank you for saying that story also to let people know that it doesn't have to be perfect from the go. So, all right. So
I
yeah,
don't love my space. I will be clear. I
who
do not
loves their
love my
space?
space, but it's what I've got for now. And I went into it pretty much just like you were talking about. This is not my forever spot, but I can set it up here. I can get
I'm,
things going. We can go from here.
I'm gonna tell you, you're gonna love, eventually you might find a place that you love, and then 5 years later, you're gonna outgrow that too.
Yeah, it's true.
It's just the nature of it, you know? So, like I did well, I also started small and then it got bigger, but now we got so big that now we transitioned to house calls because we realized we can't get any more brick and mortar. And so we're transitioning out of that as a service. So, the sky's the limit.
So
So
interesting how they were opposite.
yeah, opposite. Yeah. Because we wanted to have more patients, but we only have 3 exam rooms. There's only X amount of hours per day.
Yep.
So you're capped and like we were already seeing there's no more room on the schedule. Thank God. Thank you. So
Hmm.
to see more, we have to come to them. And so that's something that is expanding. So you can either add it as a secondary option or the way you did, which is a starter, or we have plenty of NPs that this is what they do.
Yeah.
So many options. Okay, so you started house calls. So you didn't need initial funding. You just needed a prayer.
Yep.
You just went
We
out
we
there.
I had a partner at the time, a business partner. We both just put in the same amount of money from our savings and used that.
Because you needed what, like supplies?
Yeah, supplies, signing up for the license. The EMR was the
The
most
EMR.
expensive. Yeah, that's
Yeah.
like the most expensive
Did you
cost.
have
But
like an admin at first? Like, what'd you do?
no, my business partner was the admin.
Oh, okay. So he like scheduled and whatever.
Yep, and we
And
used
then,
Google Voice. So it was a
oh,
free phone line, went right to the cell phone. No one had to have my number. We could text, we could call. He could pick it up. Once I hired staff, we didn't have an office. So I just added them to the Google Voice line and it worked really, really well.
oh, yes. That is so good. He's no longer your partner?
No,
We're
nope.
just not, we're just gonna skip that part. Okay.
Well, in all reality, that actually kind of comes into this whole thing is that if I had gone into starting the business, if we had gone into starting the business from the top down and seeing what our true vision was for, 5 years and then working from there, it would have been very clear that there was a role for him to grow in that position in the
Mm,
business. But since we were kind of more working from the bottom up, we got to a transition point where it appeared as though there wasn't much room for him to kind of grow, that he had
mm.
helped start the business, but then was like, I don't want to be an office manager, so I'm going to find another job. Um,
Ah,
uh,
interesting.
yeah, but now I see, oh, there's so many things that I could have him doing right now. He'd be
Yeah,
very busy,
you'd be very busy. But that's all right. It's exactly the way the universe intended it to be.
Yep,
And
absolutely.
wherever you are where something you love, you're in the right place also.
Hmm.
So now what's your patient panel like? How many patients do you have?
So I think we have about 3,000
God
patients.
bless. 3,000 is amazing. How
So
many do you
not all of
see?
them are in the house.
Yeah, okay. And so in the office, how many do you see a day?
About 15, 16, something
And
like
then
that.
in the house, how many do you see? Or is it different days?
So yeah, so break my days up. So I've got 3.5 clinical days. One of them I go to an assisted living. Most of the house visits are really done by another provider who works for me.
Mm, mm.
And then 3 days I'm in the office. So office days, it's like about 15 patients. I usually have a student or two. Today I had three. And the assisted living day is like a half day just because I can hit up a whole bunch of rooms,
Sure, sure, sure.
while I'm there. I spend most of my time in the memory care unit hanging out, throwing axes and stuff like that. So, but
You could do what you want. They're not going to remember. I'm just kidding. I'm just kidding. God, don't strike me dead. I'm kidding.
but it's true. It's the same but different every single day.
Oh my God, that's so. And then the other days, are you just like doing the admin piece?
Yep, that's when I'll do the admin piece. So half a day on Mondays and then full day Wednesdays. So tomorrow's an admin day, which is nice. But admin day is taken up by mom, the manager, who wants to talk about things. So so I'll be doing that. But and I try to get as much of my clinical stuff done as I can on a clinical day. So that way I'm not wasting my admin time catching up on clinical. We all know we could sit there for days on clinical stuff. There's never a shortage. My inbox just grows, grows, grows.
Never ends.
So, but you have to put boundaries in place for
I
yourself.
was just going to say that. Yeah. Those
You
are
know,
point, putting boundaries in place because it never ends. The patient will need you 24/7.
hmm
Teach your admin that too. Like I have one admin, even like somebody was screaming at her and I was like, whoa, 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 whoa. No.
Yep.
Right. That's a non-crossable boundary. We don't
Yep.
abuse, but in her effort to be so accommodating, she was taking that. I was like, no, I'm not saying you have to hang up on them, but you can certainly transfer them to me.
Yeah. Right.
So, right. So, because that's just not, but setting boundaries for yourself, especially because we're in service all the time.
Yeah.
It feels not good, but if you don't take care of yourself, if you don't set those boundaries, you will empty out so much faster.
Totally. Absolutely. There was a doctor who asked me to kind of take over his practice when he retired. And I mean, he retired early. And you know why? Because all of his patients had his cell phone number. They would call him at home. His wife was
Too
fed
much.
up. All he ever did was work. You got to have these boundaries.
You have to have those boundaries, 100%. I can't agree with you more. And giving it to yourself as nurses and as women is something we struggle with.
Yeah.
But anyone, and maybe in the beginning when you're really hustling, I can understand because you're trying so hard. But as soon as you start to see the light of day, put those boundaries in place.
Yeah. I mean, I even will put timers on my phone, like go take a break, take a shower, stop
Love
working,
that.
whatever. Because I will sit all day and all night
I
and
like
I will
that.
just work.
Yeah, I put timers to get up and stand. Like right now, I'm standing on this podcast because otherwise you
Yes.
sit all day, and we know that
Yep.
sitting is the new smoking. So, besides boundaries, what other strategies have been like super effective for you building such an amazing practice?
Yeah, no, it's definitely boundaries. Boundaries in all across though. So one of my big things that I have really struggled with is I'm not very good at juggling those hats, taking those hats off between like administrative and clinical.
Interesting.
And I'm much more comfortable in a clinical role. So that is where I just naturally land and want to be at. So, especially during a clinical day, it's really difficult for me to change those hats on demand like that. And it became really obvious and disruptive as the business was growing. Like with increasing frequency, I was forgetting to sign orders because I would,
Interesting.
I'd be come out of a room and be distracted. In addition to putting boundaries on myself, I also put boundaries with all of my staff.
Yes.
And I made it very clear that if it was a non-emergent administrative concern, that it does not occur on a clinical day. I
Love.
even made an organizational chart. It outlined where the reporting process was for urgent things, for non-urgent things. And ultimately, everything was delegated to management as their first point of contact. So then I arranged regular meetings with my managers.
Yes.
And then I don't know why. I think maybe I put myself out there too much. At least that's what some of my students say. But my staff and providers will often sometimes can be a little anxious and needy. So for some of those who are a little bit more, I arranged regular times for us to chat so that we can, 15 minutes on my way into work twice a week. Give them a call. What's going on? That way they can talk directly to me. They can write everything down and they're not chasing me out of the office when I'm
Yes.
trying to leave because they don't know when they're going to talk to me again. That has been I think, hands down, number one is really boundaries and structure.
I love that you said that. You said a few really, really important things. First is that you know your strengths and your weaknesses, right? And so sometimes we want to be everything. Like, I wish I was a great admin, but that's not your strength. And so
Yeah.
knowing that and not trying to be something, because you're just going to land in frustration. You're a great clinician. when you need to be admin, it requires a different type of mindset. And so knowing that about yourself is really important because there's a part of us that wants to do it all, right? I'm sure,
Hmm.
and then you tried and then that doesn't work out. So
Yeah, and
knowing
then
that,
I felt silly, like
yeah,
I guess I can't do it.
yeah,
But
exactly. There's a shame involved, like I can't do everything. And but really living into your strength is so powerful and allows you to delegate to others who that's their strength. And that's a learning curve for women as well, because
hmm.
we're taught to do everything.
Yep.
And then you create systems in line with your boundaries. I do the same thing. I have managers meeting, and then I have team meetings, and we have some weekly, some are monthly, and then we have like different, offshoots of that. And then setting the boundaries, like, so if you said you don't want any admin in the hallway, I don't like hallway medicine. That's what I call it. You can't come to me in the hallway as my staff and say, my head hurts. What do you think? I'm like, no, no, no. And it's not about money. I need you to be in the room. I need to take your
Yep.
vitals. I don't care that I know you for 27 years and you've been working with me. It doesn't matter. I cannot do hallway medicine
Hmm.
because there's a certain structure, right? And clinically that you have to go through. It's not magic.
Right.
And and now my whole team knows, oh, no, no, he doesn't do hallway medicine. Don't ask her. Correct. Amazing. Great. I will do all the things you need, but in this realm. So it's really
Yeah.
important. And anyone listening, like live into that in a loving, kind way. You will be your best self.
Yep.
Because then when my employee comes into the exam room, I give her my all. And in the hallway, she would not get my all.
No,
And
not even close.
you're not even close. Yeah, exactly. So it's really a strength to set that. I love that so much. So when did mom get involved in the practice? Right? Like,
Oh, when my business partner left,
did she have that skill set, or like did she learn it, or
she's just kind of been learning on the job. She did
like all of us?
yeah, right. Exactly. She was doing administrative work in an MRI department at the hospital. So
Mm.
she knew how to, like use a scheduling system and how to organize those kind of like front desk administrative items. She has learned a lot. I think Alicia is probably number one on her speed dial.
Oh my God, Alicia from Duet. Anyone listening who doesn't know,
Yes.
Alicia from Duet is God.
Yes. So she, I know everything that's going on with Alicia because my mom will tell me,
I love
send
it.
pictures, everything. But really, I mean, she's been so helpful because, like you said, we're all like learning along the way. And that's one of the big things that she's doing too. She's learning CAQH and, all these
Yeah,
other things
we're
that,
all figuring it out.
oh no.
Yes. And that's so good you're saying that because everyone, when I mentor, are thinking like, well, how do you know? Like, I didn't know. I would get a phone call and say, are you in CAQH? And be like, what is CAQH? Right? Like, that's just, we
Yes,
all figure it out like this. And
totally.
yeah, oh my God, that is so, so funny. So was there a shift for you? So, like, I know you had this community place you worked in before, and then this evil CMO came in and changed it. And so then you were like, I'm going to open my practice on my terms. Now that you own your own practice, has some of that shifted? Is there like a new perspective on patient care as a result of owning your own spot?
Yeah, I think the biggest thing is billing, I have to say, is understanding what it actually means to bill for healthcare services. Like what does that mean? What does that look like? How is it that you can make any kind of an income if you're, charging insurance and I have longer visits and I offer benefits to my employees. And so it really has shifted a lot. Like instead of me being the practitioner and really focusing solely just on the patient, now I kind of see it more as a system within our system, and I visualize or think about a lot of the different things that we do every day instead of as tasks and more as how can we make this a system and make it better? Because I
Yeah,
realize that systems are really how you make change. You don't change people, you change systems.
1000%.
You
So
know,
does that give you a newfound perspective on that evil CMO or no?
Yeah, it has. It
Yes.
has. And I do a lot of self-reflection. When I was in nursing school, I think we had to self-reflect all the time. And I was like, this sucks. This is horrible. And then I realized, oh my gosh, this is how I get critical thinking skills. And like, wow, I really am learning from different things. So I put it into practice. And that's how I figured out I'm not good at switching hats and all these different things. But it has put that evil CMO into perspective and
Yes.
how I came off just by my communication style,
Yes.
and that her focus was,
How
keeping
do
the
we keep the
business
doors
afloat.
open? Yes.
Exactly. I think that I prefer to do it a little bit more creative and figure out
Yes.
different ways to do it. But at the end of the day, we both had the same goal.
Yes. Yes. And thank you for like being candid about that, because I hear a lot of times when people are like, I left this place because I want to do it my way. And in my head, I'm like, and 5, 4, 3, 2, 1, you're going to come back and realize why it looked like that there. But
Yes.
people have to experience that themselves, because they really do think that people who are in admin just don't care.
Yep.
And it's not the case. There is a reality of paying the light bill. And
Uh-huh.
until you are the one paying the light bill, you can't even imagine like all the systems that are in place that have to happen. And until
Yeah.
you don't sleep one night because you're not sure if you make payroll the next day.
Yes. Oh gosh.
Oh gosh. Yeah, exactly. So and then so it's very gracious of you to look back and recognize that. But I agree with you. There are different ways of doing it. So we also get creative. We have a huge hospital system around us, and I share this just to give people ideas. And so we're not going to be able to compete with their salary and their benefits. But where we can compete as a small is some of the nuances of how we treat our employees. So, for example, we always close Fridays, so they always have a weekday to get their stuff done. We have a laundromat on site because a lot of our team don't have a washer and dryer, so now they can bring their laundry to work. These are things they're not going to get at the hospital. Now they just saved a weekend day from going to the laundromat. We are really flexible. If you have to go pick up your kid, you
Hmm.
will take care of each other's like patients, so they can go pick up your kid. And if they're old enough, they can come hang out downstairs till the end of the day. So there's a lot of small things that we can do as a small practice that a hospital simply cannot allow, right? A hospital
Yeah.
have 2,000 people going to bring their kids in.
Right.
And, and so and it's all free. Like what is it to put a washing, and I shouldn't say laundromat because that sounds like we're charging. It's free. What does it take to put a washing machine in? Like nothing. What does it take to let someone go get their kid?
Yeah.
That might take a little bit longer than a lunch break if somebody else is willing to cover. So there's a lot of ways to get creative and still fill the mission, and still the mission of being a profit driven, without necessarily alienating the way you got alienated. But that being
Yeah.
said, the reality is the reality.
Yeah, the reality is the reality. I see that now. Now
Yeah,
I get it.
yeah, yeah, yeah. That's amazing. All right, so what is like the best piece of advice you've ever received about running your own practice?
So the best piece of advice that I've ever received is to start from the top and work your way down.
What does
That
that mean?
So you take your vision, right? You put it right at the top, and then you take the steps working from there on how you get there. And the
Mm,
reason that I wish I had known that before, because the reason that I think that that is the best advice is, again, when I was with my business partner, we would have seen that where we were now was not where we were going to be in a year or two, and that
hmm
he still would have had a role to play. I think the biggest thing is that I have spent so much time getting caught up in the day to day distractions that sometimes I lose focus of that mission up there. I mean, that vision that's up there.
Yeah, yeah.
And so I have felt a lot like I'm moving up and down a ladder or a
Yes, yes, yes,
staircase,
yes.
without being able to pass to the next level. However, now that I'm visualizing from the vision down, no matter what, even if I've got these day to day distractions, that vision is always still there. And I know that there's a next step, that after I get through this right here, there's a next step. And then it's almost like advancing in a game, right?
Love.
So,
So good. Never lose the vision. I
yep.
love it. It's so interesting. But
So
you
that I
you
think
said you
was the
wish you
best.
know that, but I'm going to tell you,
Yeah,
you would not have appreciated that advice unless you experienced that first.
I guess that's true.
Yeah.
That is very
Because
true.
I really come from a place of no regrets. Like every single thing, even the
Me too.
worst parts when your face was in the mud, there was something. If you didn't experience that, you wouldn't be here right now. So like,
Yeah,
yeah.
that is very true. but I think it just would have kept me on track a little bit.
Here's your
I'm
top.
easily distracted. Okay. I
I
need
love this.
something to keep me on, on the straight and narrow. That's usually mom. But when she's not around,
When she's not
my
around, need something
vision.
else. And what advice would you give an NP who's thinking about starting their own practice?
That it's just keep it simple. Keep it totally simple. I speak to a lot of different, mostly in the schools around here for the NP programs. So to the graduating classes, talk to them about thinking about being an entrepreneur. Again, I'm that person who's the advisor telling me, hey, make sure you to go on. And I'm telling them, hey, you should start your own practice. And they're looking at me like this woman is crazy. But I've kind of linked it to the nursing process
You're so cute.
because, well, seriously, we use it all the time, right? You assess, you diagnose, you plan, you implement, and you evaluate. You do the exact same thing when you are starting a business. You assess your target population, you diagnose a gap or whatever it is that you're going to fill in that community. You plan, 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 plan. Implement and constantly evaluate to make sure that, is there something that could be improved? Are we going to keep doing this or did I totally fail with adding this service?
Oh
Um,
God, how many of those? So many.
a million, but
Yes.
it's all trial and error. It's all kind of part of the territory. And, but just looking at it that way, my brain just automatically works that way. Just like you were talking about your process that you go through.
Process,
Keep
yeah.
it simple. Whatever process, the nursing process is easy for me. Whatever process it is that's nice and simple on how you kind of might not even realize that you structure your thoughts or do things this way, but just do it that way. Use the muscle memory. Don't try to reinvent the wheel. Keep it
Yeah,
super simple. It's so easy to fall down a rabbit hole and make a really simple concept something ridiculously complex.
so
Don't
true.
do it. Keep it
So true.
simple. Yeah.
And also don't be scared to fail. Like I have built so
Yeah.
many businesses that failed and I have the t-shirts to prove it. We
Mm.
still walk
Yeah.
around with like some of my business t-shirts and I'm like, oh, remember that one? Yeah. So it's fine. Don't
Yeah.
don't don't worry about failing. That is great.
Expect it, right? If you
Expect
go
it.
into it
Expect
and
it.
expect it, it's that much easier to
Yeah.
to swallow it.
So what's the goal? What's the vision for the next few years?
So the vision, what I'd really like to do is I'm only in one county in Connecticut, and that's with the office and also with the home visits. I would like for my practice to have the home visit portion to be offered throughout the entire state of Connecticut and then probably move up a little bit into Massachusetts because I'm close up to Mass up there.
Oh wow.
And what I'm working on currently is trying to put together some kind of a multidisciplinary nurse led, so only NP practice, even if it's rotating specialists. But we've got primary care, we have pediatrics. I want to add behavioral health. That's a real big shortage, probably everywhere,
Sure,
but definitely
sure.
here. And GYN, that's another one that's a really big shortage. And put everybody all into one space so that it's almost like one of those centers, the hospital systems,
Yes,
but
yes,
that
yes.
is completely nurse led and is not corporate medicine and is only nurse practitioners providing nurse practitioner care to all of these people.
I love this so much. I love it so much. Okay, now we're getting to the fun part. What's a surprising fun fact about you that most patients and colleagues don't know?
Fun fact about me is that I ended up I was a troublemaker in high school
What? I can't even
and
see this about you.
I got in trouble and
Wait, how
that was
old? How old? How old? Like yesterday or?
no, like 14.
Okay.
So I had to do community service. I did it with the Red Cross at a blood drive and instantly knew that I was going to be a nurse. Like it completely changed my life. But,
Wow.
it took a little bit of getting in trouble, mom being pretty mad at me. But ultimately, when I was at the blood drive, I thought the nurses were absolutely wonderful. I loved that people just really put their trust right into them. They seemed so confident and skilled. And I was like, that's what I'm gonna be right
That's
there.
cool. That is great.
Yeah. So it ended up, not a great experience that completely changed my life in a really good way.
You know what reminds me of? This is so unrelated, but I'm gonna tell the story anyway. When my son was younger, he's now a pre-med. When my son was younger, I forgot what he did. He did something ridiculous. And at that point, he was like Ubering places.
Uh-huh.
He did something so ridiculous. And I was like, that's it. You're now taking the bus. It was like 2 buses or 3 buses to get to this location. So it just made his day so much longer. This is how you're going to behave, not paying for the Uber. And so he comes home and I was like, how was your day? And he was like, the bus is so cool. And he's got to tell me how cool the bus is. I was like, this is not what the plan was. You were supposed to be miserable from this. So it's funny that she sent you this and you're like, I have my career trajectory. I mean,
Yes.
it's so funny. That's hysterical. Just remind me.
Ridiculous.
My son did not want to become a bus driver, but it was just very interesting. Oh, that is so funny.
Yeah. So
And if you weren't an NP, what would you be doing?
commercials.
What do you mean commercials?
Commercials. I am animated. I will get on
What
the
would you
screen.
sell?
Anything. Yep. I can listen. I don't want to come up with a script. I just want to say it. I think that I'm just
Oh, you're
animated.
just like, give me the script. I can sell this.
That's
Oh, I
it.
love
One of my
it.
patients did commercials, and I was like, great idea. That's going to be my backup plan.
I love this. Commercials. Or you could
Mhm.
podcast also.
Yes, true.
Yeah, absolutely. Oh my goodness. Lindsey Maloney, no wonder they said you're wonderful. You're truly wonderful. This was like the fastest hour ever.
Well, high energy, right?
High energy. I love it so much. I'm living off of it. Thank you so much for being here.
Thank you so much for having me. I had a really nice time.
It was so good. And yeah, you're amazing. Don't stop doing what you're doing.
Oh, thank you. Thanks so much. You're amazing too. I keep up to date with all the things that you have going on and check out your website and
What?
yep, Instagram, all that kind of cool stuff. So I'm
Thank
watching you too over there. So I'll be watching for this.
Thank you. Yeah, absolutely. We'll let you know. That's a wrap for today's episode of Unsung. If this inspired you, share it with another NP who needs to hear it. Don't forget to subscribe and leave a review. It helps more NPs find us and fuels the movement. Want to join the largest NP practice network? Learn more about Duet at joinduet.com. Until next time, keep pushing boundaries and proving what NPs can do.